And you're live, Dr. Emer.
Hey guys, it's Dr. Emer. We're doing more of our facial sculpting. And remember, using fillers should be about signature feature enhancement, not about overdoing somebody or filling lines. It's about sculpting and defining a face and using the volume for underlying structure and build. And my patient today already looks really good, but he has some areas where a little bit of filler tweaking will make a huge improvement for him. And the main area for him is really his jawline and chin. He's got really strong features, larger lips, structured cheeks, structured jawline. But you can see from the side, if we drew a line from the nose to lip down to the chin, there's a big void right here. So using filler to project this forward will really change the way we look at his face. And that's our goal. So we're gonna use one of our more structured fillers called Restylane Defyne. You guys can see this is a smoother gel that has a little bit of elasticity sort of movement here. So you see when we press this, it doesn't really move a lot, but it's fluid, which is great, especially for a younger guy. If we place this on the bone, it will provide a lot of structure there. Look up for me a sec with your chin. So you see as his chin already has a nice width. We just really want to bring it forward. So there's going to be a little pinch. And what we're going to do is small aliquots of the filler. And this is like placing an implant. We're using this smooth gel to literally push forward the muscle that's on the bone.
Now tell us what kind of results this gives someone.
Well, this should really help project the chin and give a more structured look to the chin. And it just overall will balance his face much more by having some volume here. And I like Restylane products in areas where you have movement, because these tend to be freely movable and sort of be freely structured to the area, and they don't really tend to lump or bump. So it's going to give a softer look. I'm going to let that sit a sec. And one of the things I want to do for him is just give him a little more definition. Turn your head to the left. At the angle of his jaw. If you take a look here, he already has a nice structure, but if we go right to the 90-degree, there's a couple ways to do it. We're going to do some small aliquots. Not a huge. Just a little bit so he can have more of that angle there. Good. Perfect. It's going to turn now to the other side. How's the pain?
No, that's good. That's fine.
Not bad.
Yeah.
You're super strong. Not bad. So he's got some numbing. We've already done. Now we're doing some of the injection, which has numbing inside. Now I'm from the days, you guys, when we didn't have fillers that had numbing. So we had to either mix it in or you just had to deal with it unless you had numbing cream.
Tanya Walker says he's gorgeous.
Yes. Careful, they're gonna CPI.
Someone said, would Botox help under his chin?
Not really. It does help the movement of the muscle on the chin, and sometimes I tell people to use Botox there at the same time, or Dysport, for example, which is a competitor, to help stop the movement of the chin so the filler stays longer. Because sometimes if you're moving a lot, if you're very expressive.
So Jenny Lenny said that she got under eye filler under her eyes and her wrinkles stand out even more. Why did this happen?
Oh, Jenny, I'm so sorry. I want to talk to you about that. It's so important we got this. It's great. Jenny, sometimes people use fillers when they shouldn't use fillers, especially to the under eye. And if you already had wrinkles, you may have needed lasers, peels, or microneedling. So it may have just popped the wrinkles forward when you really didn't need volume. So come see us because we might need to do lasers. But check out my Emerald Skin Eye, Refit Eye. People are going crazy over it. Actually, all the beauty editors are talking about it now because it really tightens the look of the eye. We're going to go back to the chin. We're going to do our second syringe.
Now, are those his lips or did you do the lips too?
Those are his lips. Those are natural. I can't take credit for that.
Cody says that he can see the huge difference already.
Can't wait till we show him.
To see how lip filler is that God? That's God.
That's God. Oh wait, I mean Jason. No, I'm kidding. I'm joking. So we're going again right on the bone. We're giving him a little more structure. And one of the things you want to do when you're placing chin filler is not all on the bone. We're going to go in what's called the lower cutaneous lip area. And we're going to inject some of the soft tissue to give full support.
How long does this last?
This will last 9 to 12 months. And in some people, even longer. Great. Building. Now, I'm adding one more syringe because I wanted to get more volume for him. So we're going to use a total of 4. I'm giving him this one because I want him to have this extra syringe. And I really want to get a nice, a little bit. Now, some people use implants here. Some people, a couple a little higher. Just want to see the edge. There we go. But we're using filler, so at least you can see.
For those that just tuned in, what is he getting?
We're doing male facial sculpting right now using fillers for his chin and jawline, and I'm actually going to put one dab to his cheek area. There we go.
Kaylee Renee wants to come here so bad.
Where are you from? Come see us. We would love to see you.
Luis Vertigo, more is good.
Yeah, the more filler, the better. For him, it's going to be a huge difference.
She's from Kentucky, Kelly. Kelly from Kentucky.
I hope to meet you one day, Kelly. All right, so we're going to do 2 dabs right at the high point of his cheek. Very little. 2 pokes. Sorry, I know you didn't know that much here. Just to give him a little something that will balance everything. And this is to give him just more of that shadowing when the light hits his cheek. Perfect. Last one. So this is a good starting point, you guys. Well, you know what we're gonna do, you know what time it is right now. It's Emer reveal time. So we're gonna show him, now look, I think we got a nice initial improvement. We can keep going. I don't like to overdo the amount of filler at once. The great thing is by adding a little into the cheek and jawline at the same time, you see much more of this angled look. And now when he turns to the side, let's show him on the screen. He's gonna see so much of a better angle. It's amazing. Grab the camera.
You can bring it up close if you want to. Suppose the mirror.
So here, I'm gonna show you. Turn this way. Keep this here. When you turn to the side, I want you to see. Look up. Bring it forward a little bit more so you can see. Look at your chin to here and here. What do you think?
I love it. It looks good. Like you can see the difference and the angle of it.
Yeah, exactly. So more of a 90 degree, a little bit of a lift, and then here there's some projection but also width. Bring it a little bit closer. Look at your chin. I want you to see it. So I want you to take a look.
Yeah, I do see it.
What do you think?
It looks good. Yeah.
It's great.
I love it.
Not good. It's great.
It's great. Yeah.
Okay.
Amazing.
I know. So let's show you in the mirror so you can see, because it's usually more visible even in the mirror.
Oh yeah.
So what do you think?
Oh yeah, I love this. Like, and this
Yeah.
too.
I mean, look, we can build this out more. You don't want to overdo how much you put in there at once. Just a teeny bit there helps give a little lift, and then that 90-degree angle when you turn to the side, much more of this, you know, of the chiseling.
Yes.
So another successful male facial sculpting using fillers. Here we're using Restylane Defyne to elevate the tissue, to give some structure and to sculpt without looking overdone. Bye. Perfect.
Thank you.
Good job. Oh, thank you.